Hello, my name is Jones Muna. Today, we look at diarrhea in children. Diarrhea is a common cause of death in infants worldwide. The loss of fluids through diarrhea can cause dehydration and electrolyte imbalance. Most children who die from diarrhea actually die from severe dehydration. In developing countries, children under 3 years old experience on average 3 episodes of diarrhea yearly. This results in malnutrition, and malnourished children are more likely to fall ill from diarrhea. Diarrhea is the condition of the gastrointestinal tract affecting the intestines, in which there is frequent passage of 3 or more loose or liquid stools in 24 hours or more frequent passage than is normal for the child, caused by ingestion of contaminated food or water by microorganisms, often characterized by vomiting, passing watery stools and signs of dehydration such as sunken eyes. Kindly note that, frequent passing of formed stools is not diarrhea, nor is the passing of loose pasty stools by breastfed babies. The route of transmission is diarrhea, is via fecal-oral route. This include ingestion of contaminated water or food. It can also be transmitted person to person through handshake. Diarrhea is caused by microorganisms such as bacteria Salmonella, Shigella etc., viruses rotavirus etc. and parasites worms. The predisposing factors may include failing to breastfeed exclusively for first 6 months because this causes early introduction of other foods that colonizes the gut lining of the child with bacteria. Use of dirty infant feeding bottles, drinking water contaminated with fecal bacteria, poor disposal of fecal by mothers such as diapers, poor weaning practices, age group thus 6-11 months, etc. The signs and symptoms of diarrhea include the following: frequent passage of watery stools, general body malaise, vomiting, abdominal pains, fever, excessive thirsty, signs of dehydration such as sunken eyes and fontanelles, poor skin turgor, oliguria etc. Diarrhea may be treated according to cause. You can give zinc sulfate 10-20 mg, antibiotics, paracetamol 100 mg. Fluid therapy is cardinal with either oral rehydration salt ORS or intravenous fluids. Management of diarrhea is therefore according to the level of dehydration. The World Health Organization (WHO) recommends a simpler system for use by both physicians and lay health workers, which classifies dehydration as 1. None dehydration for treatment use plan A2. Some dehydration for treatment use plan B3. Severe dehydration for treatment use plan C. Thanks for listening and keep studying.